So I have an important question to ask this morning. If Medicaid is designed to help the poor with health care and the federal government is willing to provide billions toward that effort, what's the downside? Is it the possibility of mismanagement of government funds? I've heard that argument. Is it because any federal Medicaid dollars are short-term and not permanent? Well, Elena Marks will argue that the benefits far outweigh the downside. She is the president and CEO of Episcopal Health Foundation and joins me this morning. Good morning, Elena.
Good morning. Thanks for having me.
Nice to have you here. So how much money could Texas receive in Medicaid funding if it were to expand?
Well, more than $5 billion a year would come in for Medicaid expansion, and that doesn't even include the sweetener that is part of the American Rescue Plan that would be an additional $3 to $6 billion to the state, one-time dollars in that case. But there's a lot of money available to the state to do Medicaid expansion, more than there ever has been.
So why is there so much resistance to it, not only in this state but others? But there seems to be, it's a political thing. And so it seems to be political more than anything else. What is the resistance? What are the pros and cons to this?
I think you're right that it is ultimately political. For a long time, the state didn't know what would happen with Medicaid expansion. And so we've had the opportunity to watch since 2014, 38 other states go down this path. And the questions that were originally on the table, things like, is this temporary money and going away? Will this actually improve health outcomes? Will this eat up the state's budgets? Those questions have all been answered, and they've been answered in favor of Medicaid expansion. And so the opportunity now is to make the same decision we could have made in 2014, but now we can make it with a lot more information, and information that tells us that this is the right thing to do. It is cost effective, and for me, it's about people. We have hardworking Texans who simply cannot access health insurance in an affordable way other than through a Medicaid expansion.
State House over this past week has voted against an amendment to something that could have not necessarily expanded Medicaid, but provided Medicaid dollars or federal dollars to the pie. What happened with that, and why do you think that didn't pass?
Well, it happened yesterday. I assume you're talking about the budget discussion yesterday. So there's actually a bill in the Texas House that has a majority of the House members, including many Republicans, signed on to it. That would be a full Medicaid expansion bill in the Texas way, so through a waiver process, much like the state of Indiana did under Mike Pence when he was the governor there. That bill has not been given a full hearing. And so what those in support of Medicaid expansion tried to do yesterday was add an amendment or a rider to the budget that would direct the governor and the state agency, Health and Human Services Commission, to work together to negotiate with the federal government a way to do a Texas kind of expansion. Mm-hmm. And that's what got voted down yesterday. One of the Republican opponents who spoke on the issue said that he believed that Medicaid expansion was too big and important an issue for to be decided by a rider or an amendment to the budget. And that has some credibility, except that there hasn't been a hearing on the actual bill that is detailed and would provide a real mechanism for the legislature to weigh in on what some kind of coverage expansion would look like. And so we're kind of between a rock and a hard place. The normal mechanism for debating and bringing forth this opportunity for a vote has been denied, even though there are 78 sponsors, including 9 Republicans, of this bill. And then when you try to do it through the rider process, they say, no, you shouldn't use a rider process, you should use a bill process. So I don't know what the answer is. There's sufficient momentum, I would hope, behind this bill to propel Speaker Phelan to arrange a hearing for the bill.
So I've heard an argument about this, that those who are against the expansion of Medicaid said any argument about this is that, well, the entire healthcare system needs overhaul, and that if Medicaid expansion is just kind of a Band-Aid for a full laceration. So they say, we need to go ahead and do the whole program, not do Medicaid. Your response is something like that.
Medicaid is a large part of the current system, and if you want to have system reform, then you need people within the system. They are right. There's a great need for health reform. The biggest need for health reform, in my opinion, is to move dollars upstream. We have a hospital-centric health system in the United States. And when we built this system in the early and mid 20th century, it was the right kind of system. It was the best that we knew at the time. Now we know that health and healthcare really happen outside of hospitals, and that hospitals are really last resorts. And the hospitals know this, and they've embraced that. You can see hospitals doing more and more work in ambulatory settings. You can see them aligning with primary care providers. And what we really need is for enough people to be in the system, which means having a mechanism for payment, like a Medicaid insurance card, so that we can make those reforms in the system.
So we have a minute left. You're going to stick around and do Newsmakers Extra with me so we can talk a little bit more. Are you optimistic that something can get done?
I'm always optimistic. I wouldn't be in this business. I would say we are as close as we have ever been since the issue was first raised in the legislature in 2013, and that the reasons are increasingly compelling. But we're not there yet.
Right. Well,
I'd like to see the momentum continue building, and I think we can get a win-win solution that protects the Texas budget, actually enhances the Texas economy, and gives people health care that they deserve.
Right. Well, we'll look forward to having more conversation on the backside on our Newsmakers Extra. Thank you, Elena. Good to see you as always. It's a very pressing issue, so we'll continue to talk on click2houston.com.